I understand that CPS has been able to have such tremendous results in getting seclusion and restraints. The rates have gone way down in inpatient psychiatric facilities and residential. Yes. Can you talk a little bit about that?
Sure. There's a number of therapeutic facilities, what we call restrictive facilities, like locked inpatient psychiatry units, residential treatment facilities that have taken on this approach. And not just as a sort of a technique to add to people's toolbox, if you will, but to bring a completely different philosophy to the work, a completely different explanation of who these kids are, and as a result what the role of the staff should be in the lives of these kids. And it's really transformed the culture of these programs and produced some incredible results. We've had places that have been able to completely eliminate the use of mechanical, physical, and chemical restraint and locked door seclusion on their units. Many programs have had massive reduction in the use of restraint and seclusion, and it's something we're thrilled about, although it's actually not the goal. We set out to help people understand these kids and to work with them more effectively, and that's one of the very nice outcomes that usually comes along with it, is a dramatic reduction in the use of those practices, which, since we know we can reduce them without putting the kids or staff in harm's way. In other words, people actually are less at risk of being hurt when they're not restraining and secluding kids. Since we know we can do those things, it's really inhumane, and these are archaic practices to be using in any consistent way at this point.
So kind of what you're saying is that it's great, this is something wonderful that we get these results, but are you talking really your goal is to prevent people from getting to that point?
Yeah, our goal is to dramatically change how people understand these kids and work with them, because all kinds of things happen when you do. Reduction in restraint and seclusion is one, but there are all kinds of other things. Like, you build a relationship that isn't built on power and control with these kids. Many of these kids have awful trauma histories, and they come to the point where they're for the first time seeing that adults can be trusted, that adults care to learn what their concerns are, what their perspectives are, and to make sure that the solutions that are arrived at are going to address their concerns every bit as much as the adult concerns, and that's probably the first time they've experienced that. And so, you know, reducing restraint and seclusion is spectacular, but we have all kinds of other goals that have to do with the humane, compassionate, and effective treatment of these kids in general.
So what you're saying is we kind of haven't come that far since, you know, One Flew Over the Cuckoo's Nest, padded cells, that kind of thing.
You know, we're getting there, but the average American, if they had any idea what goes on in these facilities, and that's not to blame the staff or the leadership in the facilities, because they're trying their hardest. Sure. And nobody likes to have to restrain or seclude a child, but the thing is, we now have evidence-based, empirically supported ways of changing our practices, and it's just a question of getting it out there. We know it works. Now, it's not easy. It's just not something you learn in a few hours' time and then you're good to go. It takes a while to learn and to practice and to get better at, but it can be done. And now that we know it can be done, it really is upon us to make sure that every child has the benefit of more effective, humane, compassionate care.
Great.